Welcome to Science Force, where science comes alive. Hello everyone, and a very warm welcome. Today, we're looking at an incredibly fascinating piece of human physiology. We're exploring the master regulator of the human body, a tiny little structure with a massive systemic impact. Whether you're a life science student brushing up on your endocrinology, a medical student looking at pathology, or just someone keen to understand their own everyday health, this explainer is absolutely for you. Okay, let's dive into this. Right then, here is our syllabus for today's explainer. We'll be bridging the gap between everyday health and rigorous life science concepts across 5 sections. Meet the master regulator, the control feedback loop, when the system fails, recognizing the symptoms, and finally, diagnosis, treatment, and management. Section 1. Meet the master regulator. Let's establish the massive systemic stakes we're dealing with here. So, what exactly is the thyroid gland? Well, it's a very distinct butterfly-shaped endocrine gland. It sits right at the front of your neck, nestled just below the Adam's apple and directly in front of the trachea or the windpipe. Despite weighing only a few grams, its anatomical position is absolute prime real estate for the crucial hormones it pumps directly into your bloodstream. Now, what's really interesting about this slide is how we break down the workload. The thyroid produces 2 major hormones. First, we've got thyroxine, or T4, which is the main hormone produced, but acts mostly as a storage form. Second is triiodothyronine, or T3. This is the highly active form that aggressively regulates your metabolism and energy production. The body brilliantly converts T4 to T3 in your tissues exactly as needed. And while the thyroid also produces calcitonin for calcium regulation, T4 and T3 are the ones truly running the show. For those of you trying to understand why this matters to you every single day, think of the thyroid as the body's ultimate thermostat. Thyroid hormones influence nearly every single cell in our system. They regulate your basal metabolism, your heart function, and your breathing. They're absolutely vital for brain development, maintaining your body temperature, muscle strength, digestion, and even blood cell production. Basically, if these hormone levels fall, every single one of these processes slows right down. Section 2. The control feedback loop. For our medical and life science students, we're now zooming in microscopically to look at the endocrine pathways. Let's move to AST and see how this builds. The hypothalamus-pituitary-thyroid axis, or the HPT axis, is a beautifully elegant 3-step cascade. Step 1. The brain's hypothalamus releases TRH, which is thyrotropin-releasing hormone. Step 2. This TRH travels down to the pituitary gland, stimulating it to release TSH, or thyroid-stimulating hormone. Finally, Step 3. TSH acts directly on the thyroid gland, commanding it to produce our key players T4 and T3. It's a perfect feedback loop, you see. The golden rule here is a seesaw mechanic. When T3 and T4 levels drop in the blood, the pituitary senses this immediately and produces more TSH to stimulate the thyroid to work harder. Therefore, in most typical cases of hypothyroidism, what you're going to see on a lab report is that T3 and T4 are decreased while TSH is increased. It's essentially the brain shouting at the thyroid to wake up. Section 3. When the system fails. Now we transition into pathology, looking at what happens when there's a mechanical systems failure in the body. Let's break down exactly where this physiological break occurs. There are 3 types to consider. Primary hypothyroidism is by far the most common. The problem is right there in the thyroid gland itself. It simply cannot produce enough hormones despite high TSH stimulation. Secondary hypothyroidism means the failure is higher up, in the pituitary gland, which fails to produce sufficient TSH. And tertiary hypothyroidism, that's a failure at the very top, where the hypothalamus fails to produce adequate TRH, reducing absolutely everything downstream. So, What's actually causing these failures? Well, the absolute most common cause in developed countries is Hashimoto's thyroiditis. This is an autoimmune disease where the immune system mistakenly attacks the thyroid tissue, leading to permanent hypothyroidism, and it affects women far more frequently than men. Globally, however, iodine deficiency remains a massive cause. Without iodine, the gland enlarges into a goiter. Other causes include thyroid surgery, radiation therapy, certain medications like lithium or amiodarone, and of course, congenital defects present right from birth. Section 4. Recognizing the symptoms. Let's zoom back out to practical patient care, keeping in mind that because the system slows down, these symptoms often develop very slowly over months or even years. So the crucial point is how a slowed metabolism physically manifests in the patient. You see constant fatigue, weakness, and mild to moderate weight gain because the body is simply burning fewer calories. Patients experience intense cold intolerance, literally feeling freezing when everyone else around them is perfectly comfortable. You'll also see a slow heart rate alongside constipation, puffy faces, and dry, brittle hair. A very classic clinical sign to look out for is the thinning or complete loss of the outer third of the eyebrows. But it's definitely not just physical. The mental and reproductive impacts are incredibly severe. Patients very often suffer from depression, poor concentration, forgetfulness, and excessive sleepiness. For women, it heavily affects reproductive health, causing irregular or heavy menstrual cycles, reduced fertility, and a much higher risk of miscarriage. Furthermore, in infants with congenital hypothyroidism, symptoms like poor feeding, prolonged jaundice, and developmental delays mean early treatment is essential to prevent intellectual disability. We must also address the extreme end of this spectrum, myxedema coma. It is the most severe form of hypothyroidism. Thankfully, it's rare, but it is entirely life-threatening. If left completely untreated, patients can present with extremely low body temperature, severe confusion, incredibly slow breathing, and even a loss of consciousness. It requires immediate aggressive hospital treatment. No exceptions. Section 5. Diagnosis, Treatment and Management. Let's shift our energy back up and move from the problem to the medical solutions. Diagnosis follows a very clear medical protocol. The TSH test is the gold standard. It is literally the most sensitive screening tool we have. For primary hypothyroidism, as we learned earlier, an elevated TSH indicates the thyroid is failing. Doctors will also check the free T4 test, which measures the active circulating thyroxine, which will be low. To confirm if the cause is autoimmune, like Hashimoto's, we look at thyroid antibody tests, specifically anti-TPO and anti-thyroglobulin antibodies. Once diagnosed, the standard treatment is elegantly simple and incredibly effective. Levothyroxine. This is a synthetic form of the T4 hormone. By taking this, patients directly replace the hormone their thyroid can no longer produce. When managed correctly, the benefits are truly life-changing. It restores proper energy, improves concentration, stabilizes weight, and brings heart function and metabolism right back to normal. And this brilliantly illustrates how proper medical management ties directly back to our feedback loop. For levothyroxine to absorb properly and regulate that HPT axis we discussed, it must be taken strictly as prescribed. The golden rules are: take it once daily, strictly on an empty stomach, and wait 30 to 60 minutes before eating breakfast. This ensures maximum absorption, allowing that synthetic T4 to quiet down the screaming pituitary gland and lower those TSH levels right back to a healthy baseline. Well, we've covered a lot of ground today, haven't we? From the microscopic pathways of the brain to the clinical realities of patient care. It's quite amazing. As we wrap up this explainer, I want to leave you with this thought to ponder. How much of your daily vitality is quietly dictated by this tiny butterfly-shaped gland? Thank you so much for joining me to explore the master regulator of our metabolism. Keep learning, keep questioning, and I will see you next time.
Thank you for watching Science Force. இன்று ஏதேனும் ஒரு புதிய விஷயத்தை கற்றுக்கொண்டது உங்களுக்கு மகிழ்ச்சி அளித்திருந்தால் மறக்காமல் லைக், ஷேர் மற்றும் சப்ஸ்கிரைப் செய்யுங்கள்.